Enrollment begins Tuesday for the new healthcare system, but there is still a lot of confusion about the changes. Kat Villanzoni is here to break down some of those changes in part one of our two-part At Issue series, Healthcare 101. Good morning, Kat.
Good morning, Julie. We are hearing from people that they're having a hard time understanding this new system. Today, we're taking a look at the terms you need to know if you've never had to choose your own insurance and what resources are available to you during that transition. Starting the process of choosing a health care plan can be daunting, especially for people who aren't familiar with the lingo involved in the healthcare system. While you're scoping out your health plan, there are a few key terms to pay attention to. The first cost you'll encounter is your premium, the set amount of money that you'll pay the insurance company for your health plan. Most people pay these each month. Benefits are what you get under that health insurance plan, like hospital stays, cancer screenings, or prescription coverage. Your plan should tell you which services are covered and which are not. All plans offered through the Vermont Health Connect offer the same basic benefits. A copay is the flat amount you will have to pay when you receive a covered medical service. The cost of that copay depends on the service and your plan. It does not count towards your deductible, which is what you have to pay before your insurance starts helping out. The allowed amount is the maximum the insurance company will pay for a service. Co-insurance is the percentage that you'd pay for a medical service. So your insurance might cover 80% of a hospitalization, leaving you responsible for the other 20%. Now, the exact amounts depend on the plan you choose. Co-pays, co-insurance, and money you pay towards your deductible are two examples of out-of-pocket costs you will encounter. The federal health care law sets limits on those costs that you or your family will have to pay. These are only a few of the basic terms, and if you run into other unfamiliar terms during your search, the Vermont Health Connect website has a glossary where you can quickly look them up. And there are other resources available for those with questions.
Starting in October, there'll be a website that will provide easy access to side-by-side comparisons where people can go on, compare plans, pick the plan that's best for them, secure financial support for paying for their premiums if they qualify, and then be able to get coverage for January 1st.
Businesses or people with insurance questions can also contact Vermont Health Connect's hotline at 1-855-899-9600 or their website, healthconnect.vermont.gov. There you can find resources, including how to find a navigator in your area who can help guide you through the transition. Navigators can help you compare what you have now to available options, understand the terminology, and figure out your priorities for your health care.
People will have time through the fall to be able to purchase a plan for January. And so people don't have to rush out on October 1st to make their decision. There's plenty of time, again, to look at the information on the website, to call the call center if you have questions, or to sit down with somebody in your community as a navigator in order to work through what your options are.
Now, finally, another thing everyone should know is that when you do purchase a plan, it will be for a year. So it'll be before a year before you can actually change it again. And that's except for significant life events like the birth of a child. And next week, we'll have part two of our Healthcare 101 series, taking a look at those plans and what advice Vermont Health Connect has for small businesses. Julie?
Thank you, Kat. It's a lot to take in and good information there.